Insulin resistance and COVID-19 severity. What is insulin resistance? Insulin is a peptide hormone naturally secreted by Langerhans beta cells of the pancreatic islets to facilitate cellular glucose uptake and thus maintaining normal blood glucose levels through regulating glucose and lipid metabolism. Insulin resistance or hyperinsulinemia refers to impaired insulin sensitivity to mediate glucose metabolism associated with increased blood circulating insulin concentrations and defective insulin action in its target tissues, primarily skeletal muscle, liver and white adipose tissue. Insulin resistance risk. Insulin resistance is commonly presented in older adults, however currently increased in all ages, including middle-aged individuals that are overweight. Insulin resistance increases the risk for prediabetes, type 2 diabetes, viral and bacterial infection, cardiovascular diseases, strokes and cancer. Causes of insulin resistance. There are several factors developing insulin resistance including aging, ethnicity, obesity, belly fat, sedentary lifestyle, a lack of physical activity and sleep. Sugary cereals and excessive sweet drinks like sodas have contributed to obesity in both children and adults, which has increased the number of cases of insulin resistance, leading to type 2 diabetes. Clinicians suggested that measuring insulin resistance should form part of routine clinical assessment of patient who has hypertension, diabetes and obesity. What are the symptoms and signs of insulin resistance? Signs of metabolic syndrome. High triglycerides and bad cholesterol levels, HDL. High-density lipoprotein, high fasting blood sugar. Hypertension. Common clinical symptoms. Acanthosis nigricans is visible skin changes of hyperpigmentation and hyperkeratosis patches in different sites on the skin like neck, armpits, groin, navel and forehead. Hypertension in patients with obesity. A large waist due to belly fats. How do you know if you're insulin resistant? HOMA-IR stands for Homeostatic Model Assessment for Insulin Resistance. It is a terrific way to discover the dynamic between your fasting blood sugar and the responsive insulin hormone. Low HOMA-IR revealed that small amount of the hormone insulin is doing the trick to keep your blood sugars in good balance. High HOMA-IR indicating a high probability of insulin resistance. What are the hormones affect insulin resistance? There is direct connection between insulin resistance and the other unbalanced hormones. Hypothyroidism. Low thyroid hormones level, T3 and T4, induce overweight. High glucagon levels. Glucagon does the opposite of insulin and enhance release of much insulin, which can eventually lead to insulin resistance. GLP-1, GIP, and amylin. These hormones are produced from the small intestine in response to sugar intake, and subsequently high-consuming sugars increase insulin resistance. High cortisol levels. Our bodies release cortisol during stress and anxiety, which encourages insulin resistance. Growth hormone. This hormone secreted by pituitary gland and it well documented against the metabolic action of insulin. Leptin. It also has been called the hunger hormone or obesity hormone, and high leptin levels stimulate starving even after you've eaten. Adrenaline. It has been called epinephrine or fear hormone. Adrenaline increases sugar metabolism in response to insulin production. Low levels of woman sex hormones, such as estrogen and progesterone, mediate irregular menstruation and associated to polycystic ovary syndrome and insulin resistance. What is the link between COVID-19 severity and insulin resistance? Clinical observations emphasize that elevated blood sugar in diabetic patients increase the risk factors for mortality and morbidity with COVID-19. Insulin therapy is independently related to lung ACE2 expression, and hence ACE2 expression are likely to contribute to the more severe in diabetic patients infected by COVID-19. ACE2, angiotensin-converting enzyme 2, is the ligand to bind coronaviruses to target cells like lung alveolar, enterocytes of the small intestine, pancreatic beta cells and epithelial cells. ACE2 has a protective role. It can reduce insulin resistance through stimulating insulin signaling and glucose transport activity. In April, young male from Germany had been infected with COVID-19 despite feeling well. Few days later he started to feel worn out and exceedingly thirsty, and he was diagnosed with type 1 diabetes at the University Hospital Schleswig-Holstein in Kiel. Researchers suspect that coronavirus infection has been linked with autoimmune conditions, such as type 1 diabetes, through destroying beta cells. How to reverse insulin resistant. Very low-calorie diets. Losing weight and getting regular exercise. Intermittent fasting. Ketogenic diet.